Welcome to Faith in Recovery, the Path Through Mental Disorders. In this documentary, we embark on a journey to explore the complex world of mental illness and the profound impact of faith on the recovery process. Mental disorders affect millions of people around the globe, influencing every aspect of life, from mood and thoughts to behavior and relationships. Today, we will delve into various types of mental illnesses, uncovering how faith can offer hope, support, and a path to healing. Join us as we examine the intersection of mental health and spirituality, discovering how faith can be a guiding light through the challenges of mental disorders. Together, we will explore stories of resilience, recovery, and the transformative power of faith. 1. Mood disorders. First, we examine mood disorders, which involve persistent disturbances in mood. Major depressive disorder is marked by a deep, persistent sadness or lack of interest in life, lasting for weeks or longer. Bipolar disorder features extreme mood swings, including episodes of intense euphoria and deep depression. Cyclothymic disorder involves less severe mood swings than bipolar disorder, but still includes periods of elevated and depressed mood. 2. Anxiety disorders. Next, we turn to anxiety disorders, characterized by excessive and often debilitating worry or fear. Generalized anxiety disorder, GAD, involves chronic and excessive worry about various aspects of life, even when there is no apparent reason for concern. Panic disorder is defined by recurrent, unexpected panic attacks, intense episodes of fear accompanied by physical symptoms like heart palpitations and shortness of breath. Social anxiety disorder involves an intense fear of social situations, leading to avoidance of interactions and performance settings. Specific phobias are marked by irrational and intense fears of specific objects or situations, such as heights or spiders. 3. Psychotic disorders. We now explore psychotic disorders, which involve distorted thinking and perceptions. Schizophrenia is characterized by symptoms such as delusions, false beliefs, hallucinations, seeing or hearing things that aren't there, and disorganized thinking. Schizoaffective disorder includes symptoms of both schizophrenia and mood disorders, affecting mood regulation and thought processes. 4. Obsessive-Compulsive and related disorders. In this section, we look at obsessive-compulsive and related disorders marked by preoccupations and repetitive behaviors. Obsessive-compulsive disorder, OCD, involves persistent intrusive thoughts, obsessions, that lead to repetitive behaviors or mental acts performed to reduce anxiety. Body dysmorphic disorder is characterized by an obsessive focus on perceived defects or flaws in physical appearance. Hoarding disorder involves the accumulation of items to the point of creating significant clutter and impairment in daily functioning. 5. Trauma and stressor-related disorders. Moving on, we cover trauma and stressor-related disorders, which arise from exposure to traumatic or stressful events. Post-traumatic stress disorder, PTSD, occurs after experiencing or witnessing a traumatic event, leading to flashbacks, nightmares, and severe anxiety. Acute stress disorder involves similar symptoms to PTSD, but occurs immediately after the trauma and lasts for a shorter duration. Adjustment disorders involve emotional or behavioral symptoms in response to a significant life change or stressor, such as moving or losing a job. 6. Eating disorders. Next, we explore eating disorders, which involve unhealthy attitudes and behaviors related to food and body image. Anorexia nervosa is characterized by an extreme restriction of food intake and an intense fear of gaining weight, leading to severe weight loss. Bulimia nervosa involves episodes of binge eating, followed by compensatory behaviors like vomiting or excessive exercise to prevent weight gain. Binge eating disorder features frequent episodes of consuming large quantities of food without subsequent purging behaviors, often leading to emotional distress. 7. Personality disorders. We now examine personality disorders, which involve enduring and pervasive patterns of behavior and inner experience. Borderline personality disorder is marked by instability in emotions, relationships, and self-image, often leading to intense and unstable interpersonal relationships. Antisocial personality disorder involves a disregard for others' rights and societal norms, characterized by deceitfulness, manipulation, and a lack of remorse. Narcissistic personality disorder features an inflated sense of self-importance, a need for excessive admiration, and a lack of empathy for others. 8. Neurodevelopmental disorders. Next, we cover neurodevelopmental disorders, which typically appear early in a child's development. Autism spectrum disorder, ASD, affects communication and social interaction, with a range of symptoms from mild to severe. Attention deficit hyperactivity disorder, ADHD, involves persistent inattention, hyperactivity, and impulsivity that interfere with daily functioning. Intellectual disabilities are characterized by limitations in intellectual functioning and adaptive behavior, impacting learning and everyday skills. 9. Neurocognitive disorders. We now explore neurocognitive disorders marked by cognitive decline from previous levels of functioning. Alzheimer's disease is a progressive condition leading to severe memory loss and cognitive decline, affecting daily activities and independence. Major and mild neurocognitive disorders, formerly known as dementia, involve a decline in cognitive abilities that impacts daily living and quality of life. 10. Somatic symptom and related disorders. Next, we examine somatic symptom and related disorders, characterized by excessive focus on physical symptoms. Somatic symptom disorder involves experiencing significant distress and impairment from physical symptoms that may not be fully explained by medical conditions. Illness anxiety disorder features excessive worry about having a serious illness, despite few or no symptoms present. Conversion disorder involves neurological symptoms such as paralysis or tremors that do not have a medical explanation but significantly impact daily life. 11. Disruptive impulse control and conduct disorders. We now turn to disruptive impulse control and conduct disorders involving problems with self-control and behavior. Oppositional defiant disorder, ODD, is marked by a pattern of angry, irritable mood and defiant behavior towards authority figures. Conduct disorder involves severe behavioral issues, including aggression and violation of rules, that significantly disrupt life and relationships. Intermittent explosive disorder features recurrent, intense outbursts of anger and aggression that are disproportionate to the situation. 12. Substance-related and addictive disorders. Finally, we explore substance-related and addictive disorders involving the excessive use of substances or behaviors. Alcohol use. Disorder is characterized by a problematic pattern of alcohol consumption leading to significant impairment or distress. Substance use disorders involve the misuse of drugs, resulting in a range of negative effects on life and health. Gambling disorder features compulsive gambling behavior that disrupts personal, social, and financial aspects of life. Join us as we uncover how faith can intersect with these mental health challenges, providing support and guidance on the path to recovery. Through personal stories, expert insights, and spiritual reflections, we will explore the transformative power of integrating faith into mental health care.